Let's now talk about the silent signs of a heart attack. First of all, this feeling of impending doom. Also, you could be feeling numbness, pain in your jaws, also your arms. That's also a possibility. Sometimes we find it difficult to digest your food or even chew your food. Toothaches are also, in fact, a silent symptom of heart disease. Check now of the most frequently asked questions around your heart health. First of all, how does stress have an impact on your heart?
We have embarked on a Western lifestyle. We have forgotten what our healthy diet is. So, adopting a healthy diet is very important. Many people, youngsters, they have resorted to a sedentary lifestyle because they work in the IT sector, which is booming. So, giving yourself time is very important. Indulging in some physical activity is very important. At least giving 30 to 40 minutes for yourself and indulging in a good cardiovascular exercise is of utmost importance.
How important is the role of sleep in ensuring good heart health?
Sleep reduces your cortisol levels. It also gives your body enough time to recover. It is like charging your mobile phone at the end of the day. If you're spending that many hours, you're giving the phone to recharge, you need to give yourself also enough time to recharge. As every cell in your body functions in its own way and needs some form of rest to replenish, the energy stores need to be replenished, and also your hormonal levels remain more balanced if you have adequate sleep. And all of this, directly or indirectly, affects your heart health.
What role do genetics then play in heart disease?
South Asian population especially is more prone to heart diseases because of genetics we inherit from our forefathers and ancestors. In our conditions, changing lifestyle contributes to the genetic factors. We cannot do away with genetic factors, and those are one of the most important causative factors as well. So what we can do is change our lifestyles and not blame our genetics. We are at the best of health, and what we gain out of it, we have to make the best out of it.
What kind of a diet should one consider if your heart health is your top focus?
When we say a heart healthy diet, basically it means eating more of good foods and avoiding completely, or at least as much as possible, the bad foods. So what are the good foods for the heart? The foods which are good for the heart are fresh fruits and vegetables, a lot of fiber, a lot of pulses, legumes, even cereals, dairy, which is probably at least restricted to less fat, so nuts. So these are good food as far as the heart is concerned. Practically speaking, if you see the Indian household, what we've been eating traditionally at ghar is what these items are. So this is what is good. Even in non-vegetarian, eggs are good, chicken and fish is good. Red meat consumption has to be in moderation. So this is what good food is. What needs to be avoided? So in a nutshell, if I say one thing, if you have to avoid processed and ultra processed food.
What has been the impact of COVID on your heart?
Some of the scientific studies that were conducted in the post-COVID era and also during the COVID have alarmingly shown quite a bit of connection between COVID infection and heart diseases. Especially the COVID virus or the coronavirus affected the heart muscles, causing myocarditis, which is inflammation of the heart muscles. So it decreases the heart function. And in many people who had severe COVID infections, we saw significant decrease in their heart function. If you add this along with the lung disease, the breathing issues during COVID, it adds extra strain to the heart.